Hi everyone, Dr. John SCHOTT here from Balance Physical Therapy. Today I wanted to talk to you about actually a personal experience that I just went through this week. Was that I experienced a rotator cuff strain. And so it happened when I was just working out. I was doing some overhead presses, and it actually felt fine while I was doing it. And so I decided to go with a little bit heavier weight than I was used to. And so when I did the exercise, I actually felt fine. It wasn't until the next day till I really started feeling it. And so it actually started as I kind of had just a general soreness down my arm, going down the front of my arm a little bit. But then as the day went on, all of a sudden the whole left side of my shoulder and neck area was just completely stiff, and just it hurt really bad. Even any sort of really like rotational movement of my neck, trying to look over my shoulder, anything like that, it was brutal. And so I wanted to take you through my experience and how I dealt with that, and how I would suggest any of you to go about, if you experience a similar injury in the way that I did, in that I didn't experience a pop or any major traumatic injury. It was just the next day I woke up and it was like, wow, this is really hurting me. So how I started was, by self-diagnosing and figuring out that this was a rotator cuff injury, and knowing that symptoms from a rotator cuff injury can go up into our neck. I started with just some simple soft tissue work on myself. I was using one of the massage guns that I have. You can use that. You can do a foam roller. Anything like that is fantastic. Then went into doing some thoracic spine and then rotational type movements. And mobilizations, and then I started working on, and that was really all geared towards getting my tissues to relax because I was in this inflammatory state. Then I started moving into some really basic level rotator cuff strengthening. So doing simple, with a TheraBand, doing some external, internal rotation type exercises. Going into some scaption plane exercises using really light weights, and all these exercises that I was doing was pain-free, and it was to tolerance, right? And within really low range of motions to begin with. And then I stuck with that for a few weeks, and I would still work with those, in terms of the sets and reps, to a level where I felt myself working, I felt myself getting tired, but it wasn't causing an increase in pain, right? So I started with that for the first few days, doing it throughout the day, especially times when it was really starting to bother me. That's exactly when I would do some soft tissue work on myself, and more importantly, do some exercises afterwards, because if we're gonna get those tissues to relax, we gotta work into them and activate those tissues again, okay? So started with those basic level exercises, and then from there I started progressing myself, started moving my arm above 90 degrees, working further into that range of motion until I got to a point where it was feeling a lot better. So even to today, it's only been about a week since then, I still feel it. It still is not back to 100%, but the message that I want to share with you is that I didn't jump to going to speak with orthopedist, taking any sort of major pain medications, or really any pain medications at all. It was more about modification of movement, addressing what I knew the problem was that I definitely had strained my rotator cuff based on the mechanism of injury. Started with some basic level strengthening, getting those tissues to relax so I could tolerate some movement, and then just progressed it as I could tolerate it from there. So if you found this information helpful, please like us and share on either Instagram, Facebook, or YouTube at Balance PT Move.